A look at the Japanese culture. The Japanese culture has distinct beliefs and practices that change the way healthcare providers deliver and treat illness across the lifespan for Japanese patients, as well as influence how the Japanese manage and define their own health. In order to provide culturally competent and congruent care, healthcare professionals need to be aware of different cultural influences that impact quality of care and quality of life in the Japanese culture. With over 1.3 million Japanese individuals living in the United States and the highest life expectancy, nurses need to be prepared to meet the demands of these individuals. Further exploring beliefs and practices of childbearing women and their families, children, adults, older adults, and communities of the Japanese culture can increase awareness of the healthcare needs specific to the Japanese culture. Cultural attributes of Japan. Japan, or Nippon, is known as the land of the rising sun. Their official language is Japanese. There are two dominant faiths, Shintoism and Buddhism. For Japanese families, there is much emphasis placed on family interdependence versus self-reliance and independence. The expectation is that family will care for sick and older family members. Modesty is crucial, especially for women and the elderly. Same-sex nursing or nursing assistance is recommended to preserve modesty during care. Buddhist patients, especially first-generation Japanese Americans, may utilize prayer beads in health care. Japanese beliefs regarding health vary between the two dominant religions, Shintoism, which views illness and disease as unclean and impure, and Buddhism, which views aging and illness as a natural process. Many Japanese embrace Buddhism later in life. End-of-life treatment and funeral rituals are often practiced according to Buddhist beliefs in Japan. Illness stems from an interruption of flow to ki, or energy. The flow of ki can be restored utilizing herbs and shiatsu massage. Acupuncture can be used to reduce pain and eliminate toxins from the body. Many Japanese practice a combination of both Western and traditional medicine. The Japanese definition of health refers to cleanliness and hygiene, which are very important and directly linked to purity and good health. Poor health is considered shameful and must be communicated as something that could not have been avoided, especially in terminal illness. A healthy body must maintain a dynamic balance. The goal of therapy is to preserve or restore that balance. Treatment ideally addresses all aspects of a person's condition, from diet and sleep to exercise, personal habits, and work. The goal of these treatments is to restore or enhance flows of ki within the body and its environment. Japanese families are generally small. It's not uncommon for an aging parent to live with their child. Many marriages are based on love, but there are still traditional arranged marriages as well. Women typically have a child within a year of marriage, and it is uncommon for couples not to have children. Fathers are usually less involved with raising children. Infants are taken to Shinto shrines 30 days after birth to receive a purification ritual. The childbearing women of Japan. The average age of pregnant Japanese moms is 30.4 years of age. Maternal and infant mortality rates are among the lowest in the world in Japan, making Japan one of the safest places to deliver a child. The recommended weight gain during pregnancy for an expectant mom in Japan is 7 to 8 kilos, which is about 15 to 16 pounds, and that is significantly less than the suggested weight gain for an expectant mom in the Western world, which is 10 to 14 kilos or 22 to 30 pounds. Japanese midwives often suggest that the belly and ankles must be kept warm and covered at all times. It is believed that if the belly gets cold, the baby will catch a cold. The ankles must be kept covered with socks to keep pressure points of the ankles warm, because it's believed that pressure points can be connected to the uterus. Also in Japan, it is recommended that the woman stay in the hospital 5 to 8 days after delivery to ensure rest and recovery after childbirth, which is very different from the U.S. Moms usually go home in about 24 to 48 hours. Abortion is rare and not permissible in Japan, and shame is brought to the family of an unwed mother. The children of Japan. Infants are viewed as very important, and caring for children is considered to be the woman's greatest responsibility. Children usually have stronger bonds with their moms as opposed to their fathers, and Japanese Americans will sacrifice their own health for the health of their children because they are the future generation. Children are considered very impressionable, passive, and meant to be molded and guided. Japanese values, tradition, and customs are involved in the raising of their children. Children are taught to reserve and control their emotions. Many schools require rigorous entrance exams and are very competitive. This leads to stress, anxiety, and bullying. There can be difficulty re-entering the Japanese school system if the child has studied in another country. Children may smile when embarrassed or confused. Asking questions to clarify understanding and meaning is most important when caring for these children. 80% of infants are born with Mongolian spots, which are easily mistaken for a bruise. Kawasaki syndrome is the leading cause of heart disease in Japanese children 0 to 4 years old. Family and health. Family is referred to as kazoku in Japan and is most important in the Japanese culture. The eldest male of the family is considered the head of the family and is in charge of making major decisions of finances. The wife of the head of the family is in charge of the house and major decisions of the women in the family. Wives and daughters of the eldest son are expected to be the caretakers, including personal care when hospitalized. Confidentiality and respect should be maintained by all healthcare providers. Breaching either could cause shame to the family because poor health is considered shameful to the Japanese culture. Japanese adults do not like to show weakness or inadequacy. As a result, multiple approaches may be needed when offering medications like pain meds. It's not uncommon for Japanese adults to utilize herbs when sick. This should be taken into consideration when giving medications as well. Japanese adults may practice religious ceremonies at the bedside of ill patients. Japanese Americans are susceptible to colon, rectal, and stomach cancer, stroke, and hypertension. Physical exercises is recommended for colon cancer prevention, approximately 210 minutes per week or 30 minutes a day. Many Japanese adults do not effectively meet these recommendations due to a lack of available physical equipment, not seeing the benefits of exercise, and low self-efficacy. In regards to mental health, Japanese Americans often avoid seeking help for mental illness to maintain their family honor. Japanese food. Rice is considered a dietary staple in the Japanese diet. Appealing visual presentation of the meal is important. Asian Americans are known to have the lowest rate of obesity. Japanese communication. Indirect communication is important to the Japanese culture. Indirect communication includes eye contact, gestures, and silence. Japanese adults do not typically ask direct questions to be polite. Politeness is valued. Japanese adults may also smile, nod their head, or say yes but not agree with or understand what is being said. So it is imperative that we make sure that we are effectively communicating. Japanese adults believe in on, which can be translated as caring for someone who has cared for you in the past and sharing memories with them. According to the participants of this study, the care they give their loved one with cancer reflects love, but it is also a way to repay the love a person has given them in the past. Anri, or meiwaku, can be defined as self-restraint and a fear of bothering other people. In this study, all caregivers, even when they needed assistance from others, would not ask for help from family and friends. In the Japanese culture, this study indicated that it is common for a doctor to share news about a patient's condition with the family instead of with the patient. The family then makes decisions about the patient's care together, and it is common for patients to not know the seriousness of their illness, including when they are terminally ill. During a cultural assessment, a nurse should inquire if the patient wants to know information about his or her health, or if the healthcare team should speak with the family instead. Omiyari is defined as having a strong empathy for the patient's thoughts and feelings. This empathy is obtained through spending time with the patient and careful observation instead of direct verbal expression of thoughts and feelings. Inori means to pray to either gods, ancestors, or deceased family and close friends. Japanese caregivers describe commonly praying to or talking with Buddha, ancestors, or friends. They even reported imagining conversations as a means to cope with the stress of caregiving. This concept of enryo or meiwaku will help the nurse identify the fact that caregivers may not express caregiver burden and stress. They will most likely not reach out to family for help. And nurses should also be aware that the concepts of not asking for help can lead to horrible results. 1% of the suicides in Japan can be attributed to caregiver burden and fatigue. Nurses should assess for signs of burnout and utilize other members of the interdisciplinary team like social work to assist patients and caregivers. Japanese people believe that burdening their family can have both physical and emotional negative implications. Physical meaning having family members have to take care of them. Emotional meaning family members having to make difficult decisions. Elderly Japanese Americans reported having a good death experience if they knew that their death would not burden their family in any way. Preparation before death could lessen the burden of living wills, trusts, funeral planning, and moving to a long-term facility or retirement home. Many Japanese start planning and preparing for their own funeral at age 60. The National Health Insurance Act, established in 1961 in Japan, allows for anyone to obtain appropriate health care anywhere at any time. Japanese citizens must be covered by insurance. Nurses in Japan are typically public health nurses, midwives, nurses, and nursing assistants. Public health nurses focus on caring for patients, observing the course of illness, assessing functional status, reporting the patient's condition, health promotion and disease prevention, teaching about health and fitness, illness, care management strategies, and one of the main things that public health nurses do in Japan is coordinating community resources to assist families in the care of their family members. In summary, Japanese cultural beliefs and practices influence how healthcare providers deliver and treat illness, as well as impact how those individuals manage their own health. The Japanese believe in a holistic approach of managing and defining the health of children, adults, and elderly. Family, religion, food, exercise, communication, and personal habits should all be considered when caring for a Japanese patient across the lifespan. Healthcare providers must also preserve modesty, show respect, and avoid putting shame or burden on the Japanese patient and their family. Understanding the unique beliefs and practices of the Japanese culture can allow nurses to provide culturally competent and congruent care to Japanese patients across the lifespan.